Good morning, Mrs. Drew. You look sad today. Is there something wrong?
I tried to take several Tylenol tablets to kill myself yesterday. My husband sent me here. People think I'm crazy.
Can you tell me more about it?
I have been depressed, doctor.
When did you start feeling depressed?
About 3 days ago, doctor.
Did something happen? Was there anything that made you sad?
None. Well, I gave birth to a baby boy 3 weeks ago. I think I'm a terrible mother.
What made you say that?
It's just that I am not a good mother.
I'm sorry to hear that, Ms. Drew. But hey, you are not the only mother who feels that way. There are mothers out there who go through this kind of depression after giving birth. This might sound weird, but it's true. It's very hard to be a mom. And you know what? I'm here to help you.
Okay, doctor.
Now, have you ever had similar episodes before?
You mean feeling depressed after giving birth?
Yes.
No. He is my first baby.
Okay. Were there complications during pregnancy and after delivery?
There was none, doctor. I had a normal delivery and the baby is in good health.
Good to hear that. Mrs. Drew, do you think this depression is affecting your life now?
Yes, a lot.
I see. Any weight loss? Appetite loss?
Yes. I lost some weight and I don't like to eat.
How about sleeping problems?
Yes. I can't make myself sleep sometimes.
Do you feel sad? Worthless? Hopeless?
Yes.
Aha. Mrs. Drew, I shall ask you a sensitive question. This would help me learn more about how you feel. Do you mind?
Not at all. It's okay, doctor.
Thank you. Now, have you ever thought of killing the baby?
I have, but I never tried.
Do you feel ashamed of what you were thinking?
Yes, I do. It makes me feel I'm the worst mother in the world.
Okay. Have you ever been depressed before? Did you receive treatment?
Actually, when I was in college, I was diagnosed with depression. My dad passed away and I felt really sad.
I'm sorry. But I'm glad you were able to overcome that situation. How is your husband? Is he supportive?
He is, doctor. He always tries to understand me.
That's good. Are there any family members you are close with? Or friends you can talk to if you have problems?
Don't worry, doctor. I have a lot of friends to turn to.
Great. Do you know of anybody in your family who was also diagnosed with depression?
Yes, my aunt. She was depressed when her husband died.
I see. Thank you for answering all my questions, Mrs. Drew. I understand this situation you are going through right now is tough. Once you feel depressed, it is hard to get out of it. You need help. You might hurt yourself again. So it seems like the best idea is for you to stay in the hospital for a couple of days so that I can fully examine you. And I also recommend you get some counseling. That will help you a lot. In the meantime, I shall give you some medications which can make you feel better. How does this sound to you?
Sounds good, doctor. Thank you.
You are welcome.
Good afternoon. You look so out of breath. Are you okay?
No, doctor, I'm having difficulty in breathing.
Let me check your arterial oxygen. It's a little bit lower than normal. Don't worry, I've already ordered oxygen for you because the nurse already told me earlier that you're having difficulty in breathing. The oxygen should be here any minute soon.
Thank you, doctor.
Aside from difficulty in breathing, what are the things that are bothering you right now?
I'm also having chest pain.
I see. So is it manageable?
No, doctor.
Could you tell me exactly where the pain is?
It's on my right chest.
Can you still remember when it started?
It started 4 hours ago.
Did it start all of a sudden or gradually?
It was very sudden.
What were you doing when the pain started?
I was reading a newspaper during breakfast 4 hours ago.
Did you experience any trauma recently?
No, doctor.
Is the pain consistent or intermittent?
It's on and off, doctor.
But are you feeling better now or worse?
I feel worse each time I take a deep breath.
What is the pain like? Is it sharp, dull, pressure-like? Or is it similar to indigestion?
It's a pressure-like pain.
Is there anything else that makes the pain worse? Like cough or positional changes?
It becomes worse each time I move or take a deep breath.
But is there anything that makes the pain better?
Yes, doctor. I feel a little better each time I take anticoagulants.
Do you have any other symptoms like shortness of breath, cough, dizziness, fever, chills, runny nose, sweating, nausea, vomiting, diarrhea, constipation?
My heart beats faster than usual. I feel dizzy at times together with low blood pressure. My temperature goes up and I sometimes catch my breath.
Don't you feel any weird heartbeats?
No, but my heart beats fast.
Do you have any other illness like cancer, stroke, blood clot, or what we call deep vein thrombosis?
Luckily, I don't have any of those.
What about past illness?
No, doctor.
Have you had any surgeries recently?
No, doctor.
Are you taking any medications right now?
Yes, doctor.
Do you have any food or drug allergies?
No, doctor.
Is there anybody in your family who is experiencing the same symptom?
Yes, doctor.
Is there anybody in your family having problems in the lungs?
No, doctor.
Anybody had a cancer in the past?
My father has lung cancer.
Is there anything that I missed out? Nothing else that you think I should know?
No. I think that's all.
Now, I'd like to examine you a little bit. Is it okay with you?
No problem.
Okay, Mr. Jones. According to my assessment, the most likely source of your symptoms is the so-called pulmonary embolism. It is a little clot blocking your blood vessels going to the lungs. A part of your lungs collapsed, which resulted to the symptoms that you are showing right now. But we are not certain yet if it is really pulmonary embolism. Other possible disorders are pneumonia and pneumothorax. The lungs are covered with 2 layers of membranes, but there is not space between these layers. Once the air gets in between the layers for some reasons, chest pain happens, and that is what you are experiencing right now, which is what we call pneumothorax. It is less likely to happen, but there are still chances that heart problem could be the cause, like myocardial infarction. To get an accurate diagnosis, I'd like to run some tests such as ECG, chest X-ray, and some blood tests. You might also need some more complicated tests later on. Do you have any questions?
Can you at least ease my pain right now? Can you give me some painkillers?
I know that you are under a lot of pain right now. However, giving you any medication will alter your symptoms and it will interfere with the evaluation. It will only take a few minutes. I am trying to give you the best treatment possible. And I promise to give you medication after I am done. So please bear with me. I won't take long. Any other questions?
No.
As soon as I get the results, I'll let you know.